Hello, I'm really glad to be here today. I'm speaking to you all from the beautiful hills in Aptos, California. Here are some pictures of the views I get to see. I love the idea of looking up and having my heart fill up with these views. I get to see the sunsets and the fog that comes in to cool down the redwoods and the clouds next to the beautiful trees. And then the type of traffic jams that we have would be a wild turkey walking down the driveway or a skunk taking its time sniffing along the way. Anyway, let's talk about laser. What will this talk cover? I'm going to start with how photobiomodulation works, or PBM works. Then I'm going to talk about the different clinician trainings that I've been doing, and I've got some videos of me showing how to use our newest team member, the Avant laser. We have the Pro Z, and that's our newest Class 3B unit. After that, I'm going to cover the case studies that we've been seeing happening in our clinics. And then I'm going to finish with some research that I've gathered, some meta-analysis and some robust studies on photobiomodulation. And then lastly, we'll have a summary. So I hope that you enjoy this talk, and here we go. This is a really good article that explains how laser works. And it's easy to Google the title, nuts and bolts laser, and find it on PubMed. You can even get the whole article right there. There are lots of different names used for what's now currently referred to as photobiomodulation. These names included therapeutic laser, cold laser, low-level laser therapy, or LLLT. Truthfully, photobiomodulation is a process that results from the application of the light therapy. Lasers are numbered by power. So for instance, a class 1 laser is very low power. And the case studies I'm going to share to you today are from using class 3B lasers. And the class 4 laser is a higher power laser that can create heat and possibly burn the patient. Of course, the higher powered lasers, I believe they're classified as 5s, can actually cut through things. As a physical therapy teacher or passive modalities teacher at Chiropractic College, Palmer College in San Jose, I'm exposed to many different types of equipment, and it's important that my student interns don't end up misusing any of the equipment and, of course, hurting their patients. Therefore, it's really important for me to distinguish between the different lasers with them and to make sure they are aware of all the different safety features they're going to have to maintain. The FDA description of Class 3B versus Class 4 is that the Class 3B laser as a device has a power output between 5 and 500 milliwatts. And the Class 4 laser as a device has a power output above 500 milliwatts. And the maximum power output is separate from the wavelength. So you might find Class 3B and Class 4 lasers with the same wavelength. So let's talk about how laser works. The fancy sentence that I say to my students is that photobiomodulation causes photodissociation of the nitric oxide from cytochrome C oxidase, thereby reversing the mitochondrial inhibition of cellular respiration due to excessive nitric oxide binding. Well, that's a lot. And what I end up saying to them is just understand this will therefore increase the mitochondrial respiration, which will cause increased ATP, which we know is good. Another way I say it is therapeutic laser helps your mitochondria function better. And most people smile and nod and think that's great. In my opinion, using laser or therapeutic laser on an area that is painful or needs to be healed can only be useful. By helping the human body at a mitochondrial level, we're going to the building blocks rather than just trying to cover the pain. Musculoskeletal pain is a mental perception of a neurologic response to something not working correctly inside the body, such as an injured tissue. Pain is also perceived during essential healing processes of inflammation. Pain is an indicator. Pain also can be debilitating and thereby hinder the healing process. So let's talk a little bit more about how therapeutic laser affects the body, and we'll get into some case studies. I'd like to define the different players in photobiomodulation. These different letters can seem a lot like alphabet soup, or at least to me they do. Photobiomodulation is abbreviated as PBM, and that's the process. Cytochrome C oxidase, or CCO, is a chromophore and a protein that is found in the mitochondrial inner membrane. The NO stands for nitric oxide, and the ROS stands for reactive oxygen species. When cytochrome C oxidase is stimulated by the photobiomodulation, it allows the release of nitric oxide and reactive oxygen species. When the nitric oxide is released, ATP synthesis can occur more easily. Let's look a little bit more now on how this all works, how this photobiomodulation works. Let's look at the functions of ATP and nitric oxide and reactive oxygen species. ATP, or adenosine triphosphate, is our energy maker. This means that it's essential in the intracellular signaling or communication between cells. It's how our cells are able to communicate with each other, and it's of course one of the most essential things for any metabolic process that we have in our human body. Nitric oxide also is important because it causes vasodilation. This means there's going to be an increased blood flow. When you have an increased blood flow, you get more oxygen to the tissues and transport of the inflammatory mediators. In with the good and out with the bad. In other words, the normal, wonderful aspects of the inflammatory process of healing can happen more efficiently. And then there's the reactive oxygen species. These are natural byproducts of the cellular oxidative metabolism. They are important in the modulation of cell survival, cell death, differentiation, cell signaling, and inflammation-related factor production. Again, this is something that's going to assist with better and more efficient healing process. When you refer to a physiotherapy modality textbook and you look up low-level laser therapy, you'll find that the main functions that they list include the following: pain relief, inflammation control, decreased swelling or edema, promotion of healing of tissues like musculoskeletal injuries, cuts and wounds, deeper tissues, and nerves. By controlling inflammation, the goal is to prevent further tissue damage. For instance, the swelling in the ankle sprain will cause secondary tissue damage. So, to control that level of swelling during the initial inflammation response, the positives of the inflammation will be there without as many factors that might cause extra injury. The secondary effects of pain relief and inflammation control are improved range of motion and return to activities of daily living. I believe it's very important to have an outcome measure when doing a therapy, especially one that the patient doesn't feel during treatment. Therefore, doing something like a pre and post test of the involved area. I call this the poke test. You poke the area, the patient says, ow. You ask, how bad is it on a scale of 1 to 10? You get that number, and then you do the treatment for a certain amount of time. And then after that, you go back and poke the area again, and you ask, how's it feel now? Is it better? Is it same? Is it worse? Another incredibly effective outcome measure is to test how movement feels. With a lot of my cases that I'm going to be sharing today, there are certain positions that were quite painful or certain movements that hurt. Therefore, we make sure to use these positions and movements as the primary outcome measures that we do before and after the treatment. The second question is, how much should the dosage be? I found that you need a lot more dosage than some folks recommend. I suggest that my interns do a treatment for about 4 minutes and that they test the outcome measures. If there isn't a significant shift, I ask them to do another 4-minute treatment. There are articles about how much dosage is necessary. This chart is from an article that came from the Starkey Therapeutic Modalities, 4th edition, or 2013 textbook. I generally have the intern work with the patient all the way up to about a 12-minute total treatment, and then we ask the patient to give us feedback after the treatment when they come back to the next treatment. This is a picture of the electromagnetic spectrum. I've chosen one where the purple is on the right and the red is on the left. Frequently, you'll see this picture in reverse. And so for those of you who are visual learners, it's important to note that this may be an opposite picture than what you're used to seeing. So therapeutic laser is said to occur anywhere in the range of about 600 to 1200 nanometers. And that's why I said ish right here, because honestly, I've read so many different articles where that range has some variability to it. So I've given it a basic range of 600 to 1200 nanometers. The therapeutic laser is going to fall within some of the parts of the visible spectrum, and that's the red part, and then also part of the invisible spectrum, where you can see I've circled the yellow box. So the yellow box there, for me, is what I understand to be the therapeutic laser window. The longer wavelength of 808 nanometers, or infrared, doesn't absorb. It actually penetrates, and it goes in centimeters deep, and wherever it shines, it treats. The shorter wavelength of 637 nanometers, or the bright red, absorbs into the skin, and then it's going to appear to communicate with the adjacent cells from cell-to-cell communication. I learned that for pain, it's suggested we use the infrared, or the longer nanometers of 807. And for healing, that the red is the one we want to use, that 637 nanometers, or the shorter wavelength. However, in my experience of the various cases I'm going to be presenting, I found that there is a lot more variability than that. I found that when the red was used, we found pain relief and a diminished swelling. So I think this is a great way to start. However, I'm not going to stick with it. Another approach that I haven't had much experience with is something I learned from Dr. Rick Amy, and it's to treat the nerve root. And when you treat the nerve root or the nerves, it has a spillover effect to where it's needed. It's going to find its target. Meaning we know that the muscle, for instance, is the primary stabilizer of the joint, and the joint might hurt. But if the muscle isn't functioning, it can't protect the joint, and that may be why it's having pain. So if you help the nerve and the nerve root, as well as the muscles, you're going to hopefully help the area of complaint, the joint. In other words, I've heard him suggest that you do it in a sequence. You go to the local nerves and the nerve roots, and then the muscles around the area, and then the area of complaint. Again, this is something I'm about to start exploring more. I have been very much using laser locally at the area of complaint and localized surrounding areas. Let's talk about safety. At a teaching clinic, you have to be very careful because the interns are nervous about all the things they need to do, and it takes time to write out all their notes in the electronic health records, and they're worried about their first encounters or their multiple encounters with real patients from the outside world, and so on. So mistakes can happen during the rendering of physiotherapy modalities. For instance, not moving the ultrasound head and causing the person to feel a burn sensation. With laser therapy, you need to make sure that the patient uses protective eyewear. The Class 3B goggles or glasses are designed for Class 3B laser therapy. You can't use the Class 4 laser goggles for a Class 3B treatment, and vice versa. When you put these goggles on, they have green lenses, and that makes everything that's red invisible. And that's a little bit disconcerting because you don't think that there's any treatment being rendered. I have a little picture right here where you can see that I'm looking through the green lenses and you can't see the red, and then I took the green lenses away and you can see the red. When you're using the infrared setting or the longer wavelength setting, it's you got to remember that this is going to be invisible to the eye, and therefore there's no way you would know it's getting in your eyes, and eyes are one of the major contraindications to where you should aim laser. Therefore, the FDA, of course, says, hey, let's make this safer and make sure that there's always a red light that tells us when the infrared is on. So it's called like a tracker light. And the red light isn't a problem. It's the invisible part that's the problem, or it could be potentially the problem. Of course, when you use the bright red light setting, you're going to also, at the shorter nanometers, you're going to have a bright light, and that's not very comfortable to the eyes either. So it's good to wear the goggles or some eye covering during the treatments for both the doctor and the patient. And I am cautious to not have other people in the room unless they're going to also be geared with some safety features like goggles. One of our clinicians wanted to work with the sinuses on a patient, and she designed an eye covering where it's one of those eye masks that you wear to sleep better at night. And she covered it with tinfoil, and then she covered it again with some tape, so it was very opaque. And the idea was that the patient would wear that and be comfortably lying there while getting treatment, while the clinician used the green glasses to render the treatment. Other safety issues should include caution with tattoos or darker skin. In the case of tattoos, I've had a couple people report that when they had somebody do laser therapy over their tattooed area, that it became quite hot. So that's just no good. Other contraindications would be that you don't want to increase the metabolic rate of something like cancer or thyroid disease and so on. So it takes some important thinking before applying laser just anywhere or on any skin. To sum up the cold laser contraindications, I would use an acronym that we use in class, in the physical therapy classes, CHIMES-P. The full one is CHIMES-POD, but osteoporosis and dislocation are the OD, so we don't need that for here. So that would be anybody who has communication problems or inability to communicate with the doctor. If there's a systemic infection, anytime you apply something that could cause an increase in metabolic rate, you could cause that item to actually progress. Malignancy, obviously, again, it's a metabolic rate increase issue. Electrical devices, perhaps not over the things like the pacemaker or the insulin pump. I don't know if I've ever read anything about that, but it seems caution is smart. Sensation problems, it's important to remember that you can't feel, therefore you can't give feedback. So this is already a modality that people don't feel, so I'm not too worried about that. However, just be cautious, maybe keep it away from the skin rather than on the skin, and just understand there's no feedback loop there. Lastly, in terms of pregnancy, yes, that would be a contraindication if the laser was aimed towards the fetus because of the fact that laser should never be aimed to the eyes. And again, specifically for laser, it would be eyes of the patient, the doctor, the people in the room, and of course a fetus. And again, with the tattoos or darker skin or even dry skin, you should be very careful with laser because it can get quite hot. I'm going to be sharing a couple of training videos that I created for our clinicians and interns. When we get new equipment on our campus, we have to make sure that everybody understands how to use it and to make sure that everyone's aware of the safety features and precautions for each piece of equipment. The other thing is that a lot of the times, if the clinicians haven't been using a certain modality in a while, they may not know all the physiologic effects of the modalities. I'm asked a lot, when do I want to use ultrasound? When do I want to use motor nerve stim? Can I use shockwave on XYZ problem? And so these training videos were to describe exactly how to use the Avant laser in particular, because it's the newest team member of all of our pieces of equipment that we have on campus. The other pieces of equipment that we have include the microlight laser and also the Chattanooga Class 3B lasers. So we only have Class 3B lasers on our campus at this moment. If any of you are interested in seeing any of the other videos I've made, they're very homespun because I make them on the fly when I'm in a classroom setting, and you're welcome to check it out. It's on YouTube. You go to Free to Feel Healthy or search my name and you'll get to one of my videos. Once you get there, if you subscribe to it, you'll end up getting like kind of bookmarking so that you can come back to these instructional videos. My goal long ago was to create a place for my future colleagues, my then patient, or rather students, could turn to for material for when they forgot how to use a machine, or they get a new machine, and they also could always reach out to me once they get to that YouTube channel. How to use the Avant laser, the basic settings, the infrared, the red, and the pulsations. Here's the Avant laser in its case with the protective eyewear, the charger, some standard hoods, as well as some extra things like the acupuncture probes. In order to put in the password, push the little joystick on the top and push to the right 4 times. Here are the presets with the Avant: the acute pain, body balance, then there's chronic pain, and then there's inflammation and swelling setting, and then the last of the presets is the nerve reset. After you go through picking whichever one of those, you'll get a prompt to have you put your glasses on, and it'll state which hood you have, which in this case is the standard hood. And there's the red laser, and then next I'll toggle through to the infrared laser. I'm keeping it at acute right now. And here are the green glasses. Now, when I turn this on, I'm wearing green glasses, so it'll be safe. I push this button, it says put glasses on, push it again. It says red laser. Now you can see the red laser and how it's pulsing. And you can also see that right away it gives you a readout of what's been happening, what's the joule dosage and the amount of seconds taken. Now if I were to take these glasses and put them in front of the lens of the computer, of the camera, you can see it just totally makes it disappear. So you won't see the red when you're wearing the glasses. We don't see laser, we only see red. Now I'm going to change this, and now I'm switching it to infrared. So I switched it to infrared, and now I'm going to hit the go again. We're going to get a nice treatment going on here. There's the red. There's the infrared. So infrared is invisible. I'm wearing my glasses. You see a little bit of red, but look, so you see it's gone. Can you see that little bit of red right there? Let's try this out. See if we can get a little bit of red there. Now, laser does reflect, so this shiny surface can reflect back to the eyes. So here, I'll give you a little look at me. Hello. I'm wearing my glasses over my glasses. And then back to here. And then again, there's the readout. So infrared is harder to see. It's a lighter light. We call the infrared, and then we call the red the bright red. Now, fun fact, by the way, look, this means that we just did 68 seconds of treatment. I'm sorry, 73 joules of treatment in 1 minute. I'm going to hit stop there. Now, you'll see that there will be different types of flashing going on. So we're going to do a body balance. And it says red or infrared choices. So let's go ahead and try that one. There's the red. It's a different pulse if you notice. I'm going to switch it to infrared. Barely see the red there, but that's the invisible one. Hit stop. Be sure to always write down what you had as your dosage before you hit the stop button, because it disappears. We're looking at a timer because it's about a 1-to-1 ratio. So here we go. Chronic pain under red. You'll see the light. Different type of pulsing, right? Pulsation or frequency, we call that. Switch it to infrared, and there you go, you can barely see it. I hit stop, and I'm going to switch it to inflammation and swelling. So there's the full title, inflammation and swelling. I'm going to hit go, and this one's going to show red. Let's see if there's an infrared. Yep, there's an infrared choice as well. I'm going to hit stop. And then the last one I'm going to do is what we call nerve reset. This one has just a different variation of pulsations, frequencies. And then we are going to switch it to the infrared. And I'll hit stop. and that's it. Bing. Now, to turn this all off, you have to hold this down for a while, so have patience. And then it stops. Now, the fan may go on afterwards to cool down the unit, and you saw also that there was a battery readout. So after each use, I think it's smart to put it into the battery charger. That is it. Thank you for watching this video on how to use the Avant laser. I hope that you have lots of fun helping people feel great by using it. This is an instructional video where I'm showing how to use therapeutic laser with the Avant laser on a chronic shoulder problem. And I'm going to do infrared because it's a deeper treatment. So I've got infrared. And what's interesting is I can't see this red that you can see, so I'm going to put my glasses for the camera. See how it disappears? But then there it is. So the infrared goes deeper. It's about a 4 to 5 centimeter depth versus red. And with this cold laser, with the fan, it doesn't make her get burned. It's a class 3B. If I had a 4, I would have to move it. You can see, look at the dosage is showing up right here. So I'm treating an area that's bugging her. That's her area that bugs her. Now I'm going to just migrate over here to her supraspinatus muscle itself. I'll turn around so we can look at the dial. You can see it's pretty easy. And you can relax your neck, patient, whatever's most comfy for you. And I could also find things like, does that hurt right there?
Yeah.
So let's go hit the things that hurt. With something like a laser where you feel nothing, correct, except for maybe the vibration of the fan?
It's like a comfortable, small warmth.
Yeah, and the warmth is because of the light, not because of the laser. Laser, class 3B, doesn't make any heat. So she's feeling the warmth of the light bulb, essentially. And she can feel the vibration of the fan. But with something that there's relatively little feel, you got to do something ahead of time and afterwards. So a pre and post test. So let's go back to that spot. Is it changing? And I'm going to have you lean up a little bit. I would also treat her infraspinatus and all the different trigger point parts. I would also want to get into some of the tendon insertions that tend to be quite painful, like you get the periosteal reaction. So again, you just keep treating, and then at the end of your whole treatment, make sure to note what your dosage was. All right, thank you, patient. We have several lasers available to us in our clinic. The case studies I'm going to be presenting today are with the Avant laser. When we use the Avant laser, we use only 3 of the basic presets. So we use the acute pain, the chronic pain, and the inflammation setting. The unit that we use is a higher powered one. It's the Pro Z, and the red setting is 1,000 milliwatts, which delivers 1 joule per second. And the infrared setting is at 1,400 milliwatts, which would be 1.4 joules per second. I haven't tried the Pro X unit, which is the red is at 250 milliwatts at 1 joule per 4 seconds, and the infrared is 1,000 milliwatts, delivering 1 joule per second. I like how the unit has a fan in it, and it's able to deliver a strong dosage but not hurt the mechanics inside. I've had other units from other companies have to cool down, and I had to wait until the cool down, which was like about 20 minutes, to be able to use it again. I also like how on the Avant laser you can choose to toggle between the infrared and red during the treatment. You just use the up-down arrow on the little joystick. The instructions I give to my students is to choose infrared for deeper tissue treatments and perhaps more if there's a pain situation. And then the red is more for superficial and more for healing. That being said, I again found several cases where the red was used because the intern hadn't switched to infrared and was getting some pain relief from that as well. So now my recommendation is to toggle between the infrared setting and the red setting about every minute or two during the 4 to 12 minute treatment. The other question I have been asked on laser units is they prompt you to say, do you want to use pulsed or continuous? And generally I've said, let's stick with continuous. However, the Avant unit has the pulsed presets in there. It has variable frequencies depending on the different presets, and the effect has been positive. So I hear that people use pulse or continuous and they still get excellent outcomes. So I'm not going to be attached to one or the other. I think the research is still being gathered. The other thing is that the question is, how often should I treat the same person using the laser? I really feel like the length of dosage, or meaning the higher dosages, are more effective. If you can treat your patient every day, that's great. Honestly, in a therapy where your people are paying for their insurance is paying, or they're paying by cash, that may not be feasible. So with my students, I work mostly in the student base with my clinic, and then I have interns who are working in the outpatients. We've been doing 2 to 3 times a week for more significant cases. And the amount of dosage, I say go as long as you can to get the higher amount of joules into the tissue. I referred to the Avant FAQ or frequently asked questions on their website for more info about laser and dosage. In our clinic, we do adjunct therapies. So in addition to laser, there's going to be possibly several other things happening. For instance, it's a chiropractic clinic, so we will be adjusting the spine and extremities as is needed. And after the treatment, we will apply rock tape or flexible tape or K-tape or TheraBand tape, the ones that stretch in different directions. The other adjunct therapies that might occur before or after the laser treatment would be using the cupping or myofascial cupping or decompression of the tissues. My protocol is that we don't do it for a long time to cause the purple bruising, like I call it the octopus hickeys. And the other thing about the decompression is I want them to use cream, put cream on the area and move the cup, or adhere the cup and have the patient do movement patterns. So you can see there's a couple pictures where the people are moving in these pictures. The other thing is I suggest that they use instrument-assisted soft tissue massage to cause a compression of the tissues, or light scraping. Again, I don't go for leaving the petechiae or the red mark. I like to have a pushing of the tissue and finding the pattern that's just enough to kind of rub against the tissues and hopefully get things smoothed out in there. When you do the instrument-assisted soft tissue massage, you feel a sense of grinding in the subdermal layers, and after a while that calms down. I do use a thick emollient for both of the cupping and the instrument work, and it's like the thickness of cocoa butter or chapstick. The other physical therapy modalities they might use would be motor nerve stim. For instance, we might fatigue for muscle spasms, putting it at a high frequency and doing it for longer contractions and shorter relaxations. Or we might use ultrasound. Generally, folks choose the continuous ultrasound for, causing a nice deep heating and more blood flow. Sometimes folks are using the pulsed ultrasound for the intended therapeutic effect of increasing the fibroblastic activity. There are several cases where we're combining the laser and the adjustments with shockwave, and shockwave tends to be something I would use in chronic cases, but I feel like sometimes you just got to take on the area of complaint from so many different directions to make sure that the patient feels excellent after the treatment. Now to the cases I want to share with you all. The most remarkable of the cases were the TMJ ones, because they were the ones that we had first when we started using the Avant laser. There was one woman who had TMJ pain on the left side for 5 years, and she said when she ate something big, like a big sandwich, a submarine sandwich or a burrito, or she chewed chips where her jaw would go kind of diagonal when she was chewing on the tortilla chips, she would have her jaw get very painful and lock, and she couldn't finish the rest of the meal. And this again was a 5-year-long problem. Her gait, when you look at the TMJ, when you have her open and close her mouth, it had a bit of a C-shaped curve, so we were working on relaxing the muscles that was pulling it towards the convex side of the C shape. We also had trigger point work that we did with her. And ultimately, after we added the laser work, we also started having her doing these funny little tongue stretches where she stuck her tongue out in various directions so she would feel a stretch in her jaw area. The laser treatment that she got was only with the red, because at the beginning I hadn't really realized that I needed to switch the toggle over. I was just having so much fun playing with the unit. And I turned it on the red only and did it for like 10 minutes. And the patient had amazing results. The pain was reduced from about, a 6 out of 10 down to like a 2 out of 10. Then on subsequent visits, she had less pain each time she was coming in. Now, she was doing all the adjunct things as well, but I really can't say that it was only like the stretching and the massaging. The laser was the tipping point, because this had been something where she had been working on it for about 5 years to get rid of it. The other cases were, again, long-time TMJ cases with dysfunctional movement patterns. There was locking, or the chewing at various levels was painful or caused them to have discomfort. And these two, we used the red setting. Again, I failed to understand I needed to change the button, and we had good results. Now, since then, for a couple of them, we still do palliative care. So now what we do, and we get a better effect when we do this, we do the red treatment for about a minute, and then we do the infrared treatment for about a minute. And again, I have my interns go to 4 or 5 minutes and then do an outcome measure test. And then if there's still some residual problems, let's go ahead again up to about 12 minutes. Again, time is limited when you're doing treatments and you have more patients coming in. So the longer treatments do seem to be more effective. The most important thing when you're working with TMJ or sinus treatments is you really got to be careful not to aim towards the eye in any which way. So I had my interns, have the patient hold their hand up against their eye so that when they were doing the TMJ, there was a barrier, the hand, between the eye and the laser. Now, the patients are very calm and they're just laying down and being relaxed, and the interns are aiming the laser in different directions again to totally surround, stereo-like around the joint itself. We worked on the muscles as well of chewing, so that it wasn't just at the joint that we aimed the laser, but that was the predominant treatment. And the results have been great. And now we're getting referrals to the clinic to get their TMJ worked on with the laser. The second case I want to talk about was one where there was osteoarthritis, or OA, in the hands and fingers of an older woman. And the symptoms she presented with were pain and swelling, and there was also an increased amount of warmth when touching the areas because there was some inflammation going on in there. What was interesting is, again, this intern hadn't figured out how to use the unit, and she was using the red setting at first, and in that case she had a decrease in pain and swelling, and the warmth relief was noticed almost immediately. The other thing is she used grip strength to make sure that there was a good outcome measure for activities of daily living. And after just one use of 10 minutes on the red setting, aiming the laser in different directions around the joints involved, the patient had a better grip strength. Currently now, that patient is still getting palliative care through our clinic, and the intern is oscillating between doing the red and the infrared. And we're now going to find out how that will change to see how much longer the relief will last. So I'm pretty excited about that one. The next case I'd like to present on was for an acute pectoralis minor strain. Of course, that's the muscle that you can feel coming right up here from your chest into your armpit or above the armpit area. And this had been something where the patient had done an excessive workout and had pain on the site, and it was worsened with contraction. The treatment was with the red and acute setting, and the laser was aimed into the pect minor all over, wherever it hurt, in different directions, coming from above, coming from below, going medial to lateral, going lateral to medial. And the intern did test to see if the patient was receiving some benefit by having the person contract lightly after about 4 minutes of treatment, and then continued treating until about 8 to 12 minutes, depending on the visit. The interesting thing is that this was, again, a red-only setting. Now, this patient has been discharged because they no longer had pain after 3 visits. Currently, what our recommendation for muscle strains is to use the red and, of course, oscillate between the infrared and get a good, nice treatment of both of them. But the effect was pretty amazing, getting a patient feeling well in something that generally takes 6 to 8 weeks to heal in only 3 visits, and that was only over about a 2-week span of time. The next case is one about a painful and unstable thumb and wrist. And this is always frustrating to the chiropractor when you have an instability and you're wondering, well, I can't really adjust it very much. I can adjust it to align it, but I'm probably going to need to stabilize it, tape it, or put some sort of brace on it. I chose to have the intern actually try laser, and this was one of the biggest tipping points in this patient's recovery. So here's the history. She fell on her hand, Fouge fell on an outstretched hand 6 months ago, or 6 months prior, and she had now pain at rest. Her pain levels were pretty high. They were about a 5 out of 10, and they would go up to like 6, 7 out of 10 whenever she would stretch the joint in certain directions, or if she lifted up an object that was too heavy. Even a saucepan was considered too heavy. And especially when we had her go into the fall in an outstretched hand position, which is extension of the wrist in a loaded position. The pain was not just isolated to the wrist. It was the carpal bone, but also the metacarpal and as well as the radius. So all 3 of those seemed to be involved in it. The muscles surrounding the area were sore, and we had to do a lot of trigger point work with them as well. When I had the intern start working with the laser, I had him set it up with on an acute setting, infrared for 4 minutes, and then I had him do infrared again 8 minutes and a total of 12 minutes, and we had some really significant results. The follow-up is now that we are treating her with palliative care, and she'd say she's about 80% recovered at this point, and she says she notices a big difference when she goes too long between treatments. So now we have her at 2 times a week. We originally had her at 3 times a week. The total number of treatments till she was feeling at this 80% was about 4 visits. However, she then hurt her wrist again. So we are now at the point where we're restarting the system and seeing how it goes. I have him now doing infrared for 4 minutes, red for 4 minutes, and then infrared for a total of 12 minutes, just to kind of get all the different therapies within there. The adjustments we do are on the scaphoid and lunate, and actually at the elbow to affect the radius. And at the end of this visit with her, we always go into working with some rock tape. And I've cut a piece of rock tape into 3/4, or rather 2/3 wide, and I did a loop around the thumb, and then we stabilize it with another band around the wrist. And that seems to be the biggest amount of support that she needs. I wanted her to get a rigid thumb brace, but she never got one, and she seems to be doing really well with this protocol. If we look back to when she first started with us, the recovery is fantastic in my opinion. And when you have a chronic Fouge injury, they take a while. And so I'm pleased that we're seeing a really good recovery. So I would say her total treatment time, including her re-injury, has been about 2 months. And she's definitely in there 1 to 2 times a week in the beginning. And now she's down to 1 to 2 times a week as needed almost. So we're going into that next phase. But again, as soon as we had the re-injury, we put the laser back in there and did it more frequently and had some really good results. So very happy with that one. case I'm going to present is on the index finger metacarpophalangeal sprain. This was a student who'd been learning a new type of adjusting on the neck, which involves a lot of pressure. And you can see my hand pressing down against his hand, his finger there. And when there was resisted, I guess you would call this abduction of the index finger, meaning the index finger is being pushed towards the pinky, there was a pain of about 5 out of 10. When he came in, he said he didn't think anything would really work and what should he do? And I said, well, first of all, stop using that joint and let it heal. And I asked him if he'd done anything else like taping or massage, and he said no. So we went right into adjusting the metacarpophalangeal joint to make sure that it was lined up in the correct manner. There was no cavitation, however. I just believe in applying small pulses through the joints to make sure they're healthy and moving properly and get the neurology going correctly there. Then we had him, we did the chronic setting with him because it'd been going on for 3 weeks. And we thought, well, let's go for the chronic setting. And we did red for 4 minutes, infrared for 4 minutes, and then we did infrared for 4 more minutes. And it was interesting, at each of those increments, there had been no change in pain until we got to that second dosage of the infrared. And so the greatest thing is we got this person who's having pain on a specific movement pattern, and his pain was gone by the time he left that office. Now, he still has some reoccurring pain when he uses the joint in inappropriate loads. So it's still in the healing phase. And so we continue to say, don't load it too much. And we do have him rock tape the finger as is necessary. You can see that we're aiming the infrared, the Avant laser in different directions to the hand, not just to the point of pain, but also surrounding the joint and getting to the muscles surrounding the joint. The other adjunct therapy that we do is deep tissue work to the muscles of the hand and finger. And there's some pretty sore areas in there, and I would say that's like reactive muscle splinting that's going on due to the sprain of the joint. So this is, again, another very successful experience in my point of view, with the laser. And I'm looking forward to trying these out with this therapy with many other people and their different problems. A quick search in PubMed for meta-analysis of low-level laser therapy came up with some excellent studies. This one here looked at 24 different papers and treated so many different conditions, from carpal tunnel to fibromyalgia to low back pain and so on, and found that laser phototherapy appears to be effective against pain. And they also suggested that it be in addition to other adjunct therapies. Another meta-analysis paper that I found very valuable was by Kleisen, and this one looked at 18 studies and again showed that low-level laser therapy is an effective modality to reduce pain in adult patients who have musculoskeletal disorders. And some of the conditions that they evaluated were osteoarthritis, subacromial syndrome, carpal tunnel syndrome, RA, rheumatoid arthritis, and so on. This meta-analysis study looked at 31 unique randomized control trials where they evaluated how laser therapy affected the symptoms of TMD, which is temporal mandibular joint dysfunction. The outcome measures included pain, mandibular function, joint sounds, activities of daily living like chewing and so on, etc. And again, they found that it was effective in not only relieving the pain, but it improved the functional outcomes in the patients. This study was a meta-analysis looking at 17 different RCTs, and it evaluated how low-level laser therapy treatment affected shoulder tendinopathy or other conditions that we call under the broad spectrum diagnosis of tendinopathy. So anything that involved the rotator cuff muscle, tendons, and pain in that region. And it showed again that the optimal low-level laser therapy can offer clinically relevant pain relief, and it seems to even make a faster recovery to normal activities. So return to play is a very important thing to look at as an outcome measure. They also commented it appeared that using the low-level laser therapy with other therapies was very important for the overall health and well-being of the patient for the faster recovery and the better pain relief. This last meta-analysis that I'm sharing with you had to do with osteoarthritis. It was specifically in the knee, and it looked at 22 different studies. What's nice is if you look at the actual article, which is free as a PDF if you click on the link from PubMed, you can see that they aimed the laser in different directions through the different joint line, through the patellar area, through the lateral area. So you can see that the laser was administered in different manners to give relief to the patient. Again, it's another meta-analysis. It looks at multiple studies. It doesn't look specifically at things like what is the dosage or what is the length of dosage. It just looked at overall these quality studies demonstrated a positive effectivity in reducing pain and disability. And one of the important outcome measure tools that I would use for the knee would be the knee osteoarthritis disability questionnaire. And it's easy to find. I use the Ortho Toolkit to get the free questionnaires online so I can input the information, get a beautiful report, and then save it as a PDF and then attach it to my patient's electronic health records. This was a study and not a randomized control trial or a meta-analysis. And I liked it. It had a pretty sizable cohort, 80 patients. The condition they were evaluating was impacted molar in the mouth, the tooth. And they found that the folks who had the low-level laser therapy treatment given immediately after the surgery had a lower analgesic use post-surgery, versus the group of people who were given the low-level laser therapy in a delayed fashion, meaning a few days later, they had a higher use of analgesics. What I like about this study is it's pretty significant in saying earlier is better. Don't wait. Don't wait for the referral. The laser should be in the doctor's offices, in the dental clinic, rather than referring out for a physical therapy referral. The other thing that made me interested in this study is that the amount of treatment was so small. It was just 171 joules for about a 2-minute treatment, and yet it had positive effects. It seems to me, based upon my personal research I've been doing with the cases in the clinic, that the dosage could have been lengthened if they had done a 8-minute treatment. Imagine what differences they could have seen. Specifically, if they had increased the length of treatment for the delayed care group, because that seems to be the one that's a little bit more resistant in my clinical experiences. And I feel more is better when it comes to laser. Anyway, I'm pretty excited when I see these kinds of studies being published, and I'm hoping that anybody here who is listening to this webinar who is having great or even bad experiences in your clinical experiences, I really hope that you're out there thinking that maybe you could publish a paper. People say case studies are nothing, but case studies make up case series. Case series make up randomized control trials, and randomized control trials make up meta-analysis. So it's important that we have the foundation still being published. And if any of you ever have a question or would like some help in publishing, I'm I know a little bit about it. I'd love to help you. So give me a call. So what are the takeaways for everybody? What's the top 5? Well, I think I want to start with the last one first, which is it's worth trying laser treatment on your patients. Let's see, how does this work? It helps with mitochondrial respiration. Laser helps heal both the acute and chronic conditions, so I don't hesitate to use it now on anybody who comes in. I would definitely say you got to use outcome measures, pre and post treatment. Do poke the area, stress the area, have them move the area, and see what you can find has happened beforehand. Get some numbers on the pain scale and find out how those numbers change after the treatment. I've heard some folks say, well, with laser, you might not see a difference until next week or a couple days later, and I'm going to say I disagree with that. I believe that I feel very confident in saying there should be some change after the treatment, and the treatment needs to be longer. So that's my third takeaway. We were trying the short treatments and it just wasn't enough. And so go for longer treatments, but increment them. So do a 3 or 4 minute treatment, do your outcome measure test, do the treatment again, do your outcome measure test. Make sure you're varying your infrared and your red treatments. Do both because they both seem to have extremely good value in the healing of the body and making the person feel better. And combine the laser with other treatment modalities for best patient outcome. We do not have acupuncture in our college, so I would also encourage people to get other adjunct therapies that are outside of my field, like acupuncture. But I said things like taping is one of the best things to do afterwards. It provides a good tactile stimulus to the region. It's like they once said, taping is like a hug to the skin. It makes you realize you're okay there. So there you go. That's what I've got to share, and I hope this has been valuable to everybody and encourages you to get out there and get some case studies going on in your clinic and some happy patients. Have a wonderful day, and thank you so much for spending some time with me today. Take care.